I realized during the pandemic that this pandemic could have beneficial impact on the community. Some patients are now understanding the importance of having a good control of their disease, a good understanding of their disease, of being well treated. So maybe this pandemic and what happened could act as some sort of new incentive to promote better hemophilia care. Clearly, this pandemic is demonstrating again the importance of an efficient, optimal self-treatment at home. If the patients do that, they can go through the pandemic much more safely than other patients. If you have a patient who is independent, educated, managing a good treatment at home, the pandemic will be totally different to go through. It's clear that we have to invest in new technologies and clearly also the patients have to invest themselves in new technologies. And I hope that there will be initiative, especially for older patients who have less experience with new technologies to become much more familiar with new technologies. For older patients, I think we need to think about strategies to make sure that older patients, especially the fragile patients, do have access to this new technology. This pandemic is also a clear signal that most countries should be ideally self-sufficient and invest in hemophilia treatment, because during this pandemic it was quite difficult to deliver treatments in many countries just because there were no more aircrafts operating to do the job. So let's make sure that concentrates are available in this country and that more money and more resources are invested in hemophilia care. What's important too is to promote a better awareness of the importance of preventing and managing comorbidities. Let's not forget that most patients who die because of COVID-19, they have diabetes, they have hypertension, they have major comorbidities. So we know that our patients with hemophilia, especially older patients, seem to be particularly at risk of having these comorbidities. So again, this pandemic is a clear signal that we should do everything proactively to reduce these comorbidities to protect our patients. And that brings me to the new concept, which is the concept of promoting a healthy lifestyle. We know that sometimes it's difficult for our patients to have a healthy lifestyle. Let's be optimistic. It's possible to be physically more active, and let's promote this.